being dramatic.
I'm always dramatic.
All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer, and we're here with Lala Lindsay doing her maintenance Botox treatment. We are going to freeze the, out of her. No, I'm kidding. The toxins on her act so strongly. So we're actually going to do a really subtle maintenance amount. Squeeze in, show everybody how your toxin looks. Raise up. Why do you need this now? What's going on?
There's my brow is squishy.
Squishy, and you see the wrinkles. And she doesn't want to see those wrinkles, you guys. So we're going to use some toxin. But when we've done traditional doses on her, she is like the cheap date. It acts so fast and so strong. So we're only going to do a little bit. And you guys will see the subtle improvement. So squeeze in the glabella. We're going to work here so you don't look mean at work or on Zooms with people. So we're just gonna do a couple units each area. Now, I know a lot of practitioners who are on here will say that's not gonna work, but I'll tell you, she's very, very responsive. We've done every dosing and all of a sudden it just kicks in like crazy. She's the dream for a Botox injector patient because you don't need as many units, it's a lot less expensive. So we're gonna work there. We're then gonna go to her forehead.
May I ask Dr. Emer why he doesn't use Botox on himself?
Because I don't want to. I love my skin how it is. But eventually I'll let one of our providers do it. Okay, raise up, relax. So we're gonna do, again, very subtle, very small bits because we're calling this microtox or Broadway dosing is what I used to call it when I lived in New York during my residency. Because you wanted to just do enough where people could still have expression. And we did it. Are you guys saying that I'm unattractive because I don't have tox? I don't mind having some wrinkles, you guys. It's okay to age gracefully. Not everyone needs to have the treatments done. I do a lot of lasers and peels. Are we also doing the bunny lines?
Mm-hmm. Look at them.
Look, we're bunny lines, you guys.
So
Look at those.
what time do you close?
Depends. Depends when we're done. It depends when we're done.
Filler Friday.
Filler Fridays are always very busy. We got lots of fillers today. So squeeze in, show them the bunny lines so you guys can see. Again, if she gets mad, you don't want to see those lines. So we're going to work on the bunny lines. Usually people will teach 2 injection points, actually a little better to do 3. The nasalis muscle envelopes the nose. So if you do just the sides, the middle could actually hypertrophy. It makes it look a little bit worse. So we're going to do a little tap on the side. 1, 2, 3. That's the trick, you guys. I can't give you everything away. Now, a couple units a spot. So we're gonna.
Is there a treatment Dr. Emer wants to do on himself that he hasn't done yet?
Penis filler. I'm kidding. I'm kidding. I don't need it. But regardless, squeeze in, relax. No, I would do a lot of treatments, you guys, like lipo and things. I just don't have the time. I want an upper bleph. Dr. S, our new plastic surgeon, is gonna do, Dr. Sandon's gonna do my upper bleph this year, and I'm gonna have my team do a CO2 laser. We'll do it all on live sometime this year. Okay, and remember, over here, you don't wanna go too deep, because if you go too deep, what can happen? Do you guys know? Does anyone know? Providers on there, what happens if you go too deep over here? Blindness, no. Oh my God, that's with fillers. This is a toxin. There's a muscle that goes all the way down here. Levator labii alique nase. I forgot the upper. It's LLALI, and it will drop the lip. So she will not be able to speak or smile for 3 months. So don't do that, okay?
People
A
love
little bit
using
extra.
ours.
Her eyes have some little threads. They have a little filler in there, and they're beautiful in color. Naturally, we didn't do that. So, lastly, we're gonna work on our crows. So smile as big as you can. And look, you guys can see she doesn't have a lot of bunching underneath, but there's a little bit on the side here. We want to keep this brow elevated. So we're gonna work on the side here. Okay, we're just gonna do a little depot injection on the side for her crows. But one of the things I like to do is come up in the superior portion, the brachularis, and then again, a little bit closer to her eye to get that little angle and the little extra dots. A little dot there on the edge of those wrinkles. See right
Someone
there.
said you can't do Botox in the smile lines.
You can, it's not gonna do anything, or if you do, it could potentially drop the mouth. I wouldn't want that if I were you. Could do anything you want, doesn't mean it's a good idea.
After how long is radius completely gone?
Year and a half, guys, 18 months, 12 to 18 months. So that's really it.
Can you ask him to clarify?
Talk to me.
Also do Botox in the middle of the smile line, please.
What'd you say? I don't want to do Botox here.
No, I don't want it there
Because
either.
there's a bunch of muscles, zygomaticus major, buccinator, and these others that come together, and this mouth will look like this if you do it improperly.
I don't want that. I don't want to look like that.
Someone said, why no speaking or smiling for 3 months? That scared me.
No, that can happen if you inject improperly up here. So we didn't inject improperly, we did it perfectly. So that's our toxin injections, you guys, our preventative tox. Why do you love having toxin? And why should people consult with you?
Because I want smooth lines here so my makeup doesn't crease in it and I look
that.
younger forever.
Exactly. She needs no makeup creasing and she's got to look young forever. So she's been emerized, you guys, and we'll see the results in 10 to 14 days. Bye. She's like a little kid. You know?